Hello and welcome to episode 3 of the Wor Wellbeing podcast. I'm very excited to be joined today by Stephen Chater and Lewis Lovelock-Millen from the Northumbria Public Health team. Hello. We'll start off just by kind of getting to know a little bit more about you two. If you can tell me a little bit about your roles in the Trust's Public Health team.
Hiya, so I'm Stephen Chater, I'm the Staff Health and Wellbeing Lead for Northumbria, based within the Public Health team, as you said there, Sarah. I'll let Lewis say who he is.
Yeah, hello, I'm Lewis Lovelock-Millen, Health Improvement Practitioner for Staff Health and Wellbeing and Physical Activity, also in the Public Health team.
Fantastic.
So I think broadly, I think it's important to say that as a trust, we really care about our staff and we want to look after them, make sure that they're well. One of the big parts of the role is coordinating the staff health and wellbeing integrated delivery plan and being involved with the steering group. We'll talk probably a little bit about that as we move on. But there's loads of different people who play a key part in promoting health and wellbeing. So it's really about trying to pull all those things together into a bit of a cohesive whole.
Yeah, excellent. So what work have you got going on at the moment? Loads of exciting stuff. Tell us all the highlights.
Well, there's plenty. I think we'll start off with something that's really at the front of our mind at the moment, which is our financial wellbeing advice phone line. So it's a confidential phone line. We're working in partnership with Legal Care and Citizens Advice to make sure that staff have got somewhere where they can go to call and get some advice about things that could be, troubling them about their financial wellbeing.
Yeah.
So that's a big one.
I bet that's huge at the moment. Has it been really popular?
Yeah, it's going really, really well. Obviously, the big thing about it is we don't take any personal details. People phone an external organisation. So we want people to feel comfortable and confident calling the phone line, knowing that, it's not being shared with us. We don't know who's used it. We just get some really basic information about the types of things that people want support with.
Right.
So it's gone really, really well so far. Don't know when this is going to go out, but the phone line's currently running until the 31st of March. So we're just hoping that people can access it whilst it's still running.
Brilliant.
The other thing I'll probably mention, just along the lines of financial wellbeing, is our ongoing partnership with Northumberland Community Bank. So we've had a partnership, they're our payroll partners. We've had this for a good number of years now, and we're just trying to increase the number of members of the bank. So we want to try and create a savings culture within Northumbria where people have got money kept back, if something that they weren't, unforeseen came up, they can, maybe pay for a washing machine that's broken, or cars broken down, or Christmas presents, just thinking coming out of Christmas.
Well, at the moment, I wish I'd joined the community bank.
We've got over 1,000 members, so it's gone really, really well so far. And the other thing is people can get an ethical loan from the bank, so people can apply, join the bank, and hopefully it steers people away from things like loan sharks, payday lenders, and that sort of thing.
So when we say ethical loan, we mean kind of just a decent interest rate, somewhere where they know that they can trust the information they're being given. Yeah.
Absolutely, yeah. I don't know, Lewis, if you want to speak a little bit about the mini-MOTs?
Yeah, so we currently have a service called Staff Mini-MOTs, and it's basically an opportunity for our staff to come in and get to know some of their numbers around their health and wellbeing. So it's a 20-minute appointment, and in this appointment we'll do the likes of blood pressure, heart rate, BMI, waist circumference, CO levels, which is carbon monoxide, alcohol consumption, discuss physical activity levels, mental well-being, and there's also a lot more. So in this appointment, you'll get a booklet, and your results will be recorded down in the booklet, which you can take away. The booklet also has different signposting, so it's got the likes of websites, QR codes, and that's both for trust services as well as external services as well. We currently offer private bookings, so this would be if yourself or your colleagues in a team or department have an interest in getting these done. We can come to you. We do half-day sessions and full-day sessions. So a half-day session would look at about 5 to 6 appointments, with a full day being about 10 to 12. We'll also have individual appointments, which hopefully soon to be, there will be a booking platform up and running, which is what we'll know about at the time.
Oh, brilliant. You've answered everything that I was going to ask you about mini-MOTs there. I have not had one myself yet, but I need to get one booked. Anything else that's burning in the public health team that you want to let us all know about?
Well, I mean, as you'll be more than aware, Sarah, we do something called Click and Connect on a monthly basis on the last Wednesday of every month at 1 o'clock. So we've been doing them since before I even started actually in the role. So there is a good 3 years worth of Click and Connect sessions, 45-minute sessions where we get guest speakers to come along and talk about all manner of different topics. You know, you spoke about one of the new amazing programs that you're running currently with Staff Physio. I don't know if you want to go a cheap plug there.
Name drop the Happy Healthy Mums, which we will be discussing in a future upcoming podcast. But yeah, it's just a great platform, I think, Click and Connect, for kind of getting the word out more widely and getting people on board with things.
Yeah, they kind of fall into two broad categories. We have like the lived experience type talks, and we work a lot with our staff networks when we do those sessions. And then kind of the ones where we're maybe bringing an expert, you know, staff psychology perhaps, a dietitian or someone external. We're going to have someone coming up soon who's got a PhD in music, and he's going to be talking about how music affects health and can impact on health in a positive way. Brilliant. So we're really, really excited about that. He actually has a PhD in heavy metal.
I knew you were going to mention that.
Yeah, I'm quite excited about this. So yeah, and we've had all sorts over the years. We've had people talking about stress and burnout. We've had people talking about their experience of coming out. We've had people talking about how they manage being a carer with a full-time job. You know, and everything in between, really. So we always think we're going to run out of things to cover, and yet we never seem to. So it's all good. The other thing we've been doing a bit of work on over the last probably 4 months or so is looking at how our offices are set up to see if we can make them more active, because we know that it's difficult sometimes for people to fit physical activity into their day, and we know that the body likes to move, it doesn't like to be static. So we've been looking at different things, and I know we've been working with you, Sarah, on a couple of different things like walk-in meetings, standing desks, online exercise classes, those sorts of things. Yep. So it's all good. You'd think we were almost like set this up, wouldn't you? And so it's given us some really good evidence to take forward when we're looking at the development of new buildings and redesigns and things like that, you know.
Fantastic. Good stuff.
Lewis, I don't know if you...
Staying on the physical activity front, we'll do step challenges to try and increase physical activity levels amongst our staff. So last year in 2023, we had a step challenge, which was from Land's End to John O'Groats. It was the biggest challenge we had yet. We had 223 teams sign up, which was about just over 10% of the workforce. All the teams combined, everyone involved did 258 million steps, which is really good. So we'll be also doing one this year, so Step in the Summer again. We haven't yet planned a route, but that'll be coming out soon. So do get involved with this. It's a really, really good and interactive challenge. It's good for team bonding. It's good to get moving. So keep an eye out for that one coming. We had last year, the winners were Scrambled Legs from the NSEC catering team, so big up Scrambled Legs if you're listening.
I mean, I feel like my team, the Wellbeing team, should win that challenge. There's something really gone wrong if we don't. And yet we didn't.
Yeah.
I wasn't there this time last year, though. It's all going to be different. It's all going to be different this year. So which month does that launch? We'll be looking to do it in June. Okay, so we tend to use like National Walking Month as our lead-in. The other thing I was going to mention, Sarah, is just we're launching some new e-learning covering wellbeing conversations. So it's something that we've been, as a trust, we've been doing for a while now, but there's been some national training previously, and we've now developed our own local stuff because, you know, Northumbria would like to do it our way. And so that's going to be launching really soon, and you can access that on ESR and Calidus. So there will be something in the comms bulletin coming up fairly soon, just launching that e-learning. Okay. So it's just to really encourage it, and the idea behind it is that we want every single member of staff to be given the opportunity to have a wellbeing conversation with either the line manager or a trusted colleague, because we really want to get those conversations going. We want people to feel comfortable and confident asking for one of those chats. Yeah, it's so important, isn't it, that it's not just kept to that kind of formal one-to-one check-in or appraisal or whatever, that you feel like you can have those conversations in a bit more of a casual way, I suppose. Yeah, completely. And I guess the other big thing is that whole thing of raising awareness, because it's all well and good as
having all these great things, but if nobody knows about them,
Yes.
it's kind of a bit of a waste of time, isn't it? So as you'll know, you've accessed a couple of the things that we've been doing recently. We get involved in new and transitional line manager training on a monthly basis, because we know that managers are really important to getting information to the people that they manage, and supporting them, so important. But we also deliver on all of the apprenticeship programs, the trainee nurse associates and the preceptorship program as well. So it's really very much about getting the word out.
Yeah, yeah. And so if people want to find out about, say, the mini-MOTs or find out a little bit more about active officers, where would they be best place to go to find out about the work that you guys are doing?
Yeah, so the best place would be the staff wellbeing portal. So when you load up the internet page, it's one of the tiles on there. If you go on the staff wellbeing portal, you'll see that we'll have 9 key tiles which we like to kind of promote, and that includes the likes of physical fitness, financial wellbeing, mental wellbeing. Some of the things that we just discussed are on there, so you'll see the likes of the staff mini-MOTs, the wellbeing conversations, and there's some other bits and bobs as well, such as like our case study, so you can go on and have a little look and see what we have done in the past and how that's positively affected staff. And then your health as well is also on there. So we'd love to direct to the staff wellbeing portal. That's our landing page. As well as those that I've mentioned, we've also got every Click and Connect session which we ever had uploaded on there as well. So if you were to miss one, they're all uploaded on there. There's a YouTube series link there for you to have a look at all the ones from when it first began.
Fab. Good binge listen to those, couldn't you, if you wanted to?
You'd be on for hours.
So, Stephen, you mentioned at the start of our chat a little bit about the staff health and wellbeing integrated delivery plan and what the Trust is hoping to achieve. Do you want to tell me a little bit more about that?
Yeah, definitely. So, how I mentioned that there's so many people involved in staff health and wellbeing, from OC health to public health, staff psychology, staff experience, libraries, staff side, estates, HR, and I'm probably missing loads of people, so apologies in advance. We need to have something that pulls that all together, and that's what the integrated delivery plan is really trying to achieve. So it's based upon NHS England's health and wellbeing framework for staff. So there's 7 domains within that. So, for instance, data insights is one of the domains. And so, an example of how we use that would be thinking about working with our colleagues in staff experience to use the staff survey to find out what it is that staff need or want from health and wellbeing. We get all of those results, and our public health data analysts are able to crunch the numbers and do clever things with graphs and pie charts and give us a more in-depth and granular information about what it is that staff want. That allows us to then try and address that.
Yeah.
Another example might be one of the domains is leaders and managers. So I mentioned before about how we do transitional line manager training. So what we want to do is ensure that all of our managers have got the skills to and the awareness, I suppose, to support staff with their wellbeing. So that's just 2 examples of the 7 domains and all of the different actions that fall underneath that.
Yeah, that makes sense, because otherwise, people are singing from different hymn sheets, aren't they? I know also that the Trust just achieved Re-accreditation on the Better Health at Work award, which sounds very swanky, but I don't really know much about it. I'm still using the I'm New card. So tell me a little bit about that.
Well, I've got a little bit of previous, because in my previous job I used to work as a Better Health at Work award coordinator.
Well, so I thought you were going to say there, because I've won lots of those.
No. So we've been part of it's a regional award structure that's been going now for probably about 15 years now. So any organisation from across the region, be it public, private, charitable sector, can sign up to the award, and it's got a set of criteria that you've got to try and achieve to meet different levels of the award. So the Trust's been involved for a long time now, and we are now at the level of maintaining excellence, and on top of that we are considered to be ambassadors, which sounds very swanky indeed.
It does.
So we just got re-accreditation for that this year. And obviously all of those people and more that I mentioned before that are involved with the steering group and the delivery plan have been involved in, providing information and all the evidence that goes towards us getting that. And again, it's something that we've been involved with for a long time. So my predecessor, who was in post for probably 10 years ago now, was one of the first staff health and wellbeing leads in an NHS trust in the country. So I think that goes back to saying how embedded health and wellbeing is within this trust, and it's not something that's brand new. People have been working towards it for a long time. But I think the key thing is, I know sometimes when people talk about awards, it's a bit like, you know, just getting an award for an award's sake, and that's not what this is about. So really, the award is the kind of the happy accident that falls out of doing this stuff for the right reasons. You know, we always want to, you know, benchmark against other organisations and benchmark against ourselves, and always strive to improve, because there's always something more that we could be doing.
Yeah, but it's, I mean, again, playing the whole newbie card, being here for less than a year now, I can feel how much it's embedded in the culture, and like you say, kind of how much genuinely there is a lot of care about how the staff are doing on a day-to-day basis and in the longer term.
But I think as well, what's good about it as well is that we still recognise that there's more to do. Yeah. You know, yes, there's been loads done by loads and loads of people. It's a real team effort, but there's always more to do, isn't there?
That's why our workload's so big, because there's always more that you can do to enhance wellbeing. Which brings me nicely on to asking Lewis if you could tell us a little bit more about the Health and Wellbeing Champions. Yeah,
so Health and Wellbeing Champions is basically anyone in the organisation, you know, regardless of role or experience, anyone can be a Health and Wellbeing Champion. We'd love to get a champion in every single team across the trust. We currently have 192 champions, and that number's ever growing. So basically a champion is just someone who's passionate about health and wellbeing, wants to help raise awareness on health topics, and wants to contribute towards a positive culture. The role itself is voluntary, and it's a great addition for your CV. And whilst being a champ, there's opportunity for you to gain some public health knowledge. There's opportunities for CPD, and also to be a part of the trust MEC approach. So a typical thing which a champion might do is just help signpost colleagues to sources of support or advice. Establish staff wellbeing as a regular agenda in team meetings and huddles, because staff wellbeing can often be one that's missed off when it comes to these things, and we identified as a key topic, so hopefully champions can help embed that within their own teams. The champions can obtain feedback and get suggestions from staff in their teams and departments, and feed that back to, you know, myself and Stephen, as well as your likes of Sarah, Kaylee, from the wellbeing team, and what we can also do to keep on improving the service which we offer. We need champions are really important, because, as me and Stephen said, it is us two from the public health team across the whole trust, so just the two of us. So they do play a vital part in creating a healthy workplace. We've got a variety of people carrying out the role, which enables us to reach more staff across the trust. We'll also find that staff engage better with people that they actually know. So obviously, you know, with your colleagues, you do engage better from that. But if you want to become one, that'd be great. You can find the application form on the Staff Wellbeing portal, which I was discussing earlier. We've got a whole tile which locates Staff Wellbeing portal on there, and also the Health and Wellbeing inbox as well.
I think I would say, I know Stephen's going to say something as well, that people should really realise that it's not going to take up too much of their time. You know, I get, because I'm a champion, I just had to drop that one in there. But, you know, I get invites to lots of fab things that I can kind of do to help with my own learning and my own awareness, but there's no pressure at all. Obviously, if you've got, how many did you say, 190?
192 at the minute,
you know, you're not going to get all of those people coming to all of your training, but it's about picking and choosing the things that possibly work best for your team, I guess. Yeah, Stephen?
And I think before we pressed record, we were just having a bit of a conversation about MEC, weren't we? And I guess that's where this fits in, you know, this principle of making every contact count, which is the trust overall is signed up to taking a MEC approach to not only staff health and wellbeing, but also patients' health and wellbeing. And our champions are trained in MEC, so it's really about pushing those messages out there, having really brief conversations, providing a little bit of brief advice to people. It's not taking up too much of your time. But I didn't want to go too much into MEC, because I reckon you've got another podcast.
There's another podcast in there,
to talk a little bit more about that.
But that is something that is offered to your health and wellbeing champions. And I think, having done it recently, it's really valuable training. So definitely search that out on the portal. Ask around in your team, you know, if is anybody a champion on this team? You don't want to be the team with no health and wellbeing champion. And
I think our amazing sound engineer and producer here would make a wonderful health and wellbeing champion.
I don't think I don't think he's allowed to talk, is he, when he's recording? But we've locked the door.
He can't
anyway.
say no, though, can he?
We'll make sure before he leaves this room he's signed up. Right, I'm going to round up with one last question that I've asked everybody who's been on the podcast so far, and that is really simple. What do you do to improve your own well-being, fellas?
To improve my own well-being, I think for me a key thing's just always having something to look forward to, whether that be, you know, large, such as going on holiday, or just having something as small as going to see me grandma and granddad during the week for me tea. Doing those sort of stuff does, you know, look after me well-being, staying motivated during the week, and it's a nice reward at the end of it as well. And that's what I like doing, spending time with people that I love and that.
Yeah,
so
I think that's brilliant, actually, because sometimes well-being, you can overthink it, can't you? You know, think you've got to be doing a yoga course, or you've got to be embarking on mindfulness, but actually just, like you say, having something every few days or every week that you've got to look forward to is massive. Yeah. Stephen, what's yours?
So I'm probably going to be a bit boring. There's probably loads of people who are going to say this, but I like to go to the gym, or the garage, as I like to call it.
Guess who else said that? Kaylee Bradley.
I know.
She said the gym.
I know. I feel
No,
it's disappointing, isn't it? I've disappointed you.
Not at all. Tell me why.
But probably more. Well, no. Let's not talk about the gym. Let's talk about something else. So I like to go out for a walk on a lunchtime and listen to a podcast. This one when we've got a few banked up. Yeah. And just clear my head. And I always find it that I come back really refreshed for the afternoon at work. Yeah. Amazing, you know, you can go out there and you feel like you've had a morning of meetings and all sorts of other things. And once you've been out there for a walk, you know, I always come back, you know, firing on all cylinders. So I think that's it's the big one for me. Yeah. So gym in the morning, podcast and a walk at lunchtime.
Fantastic. You've made me feel like I need to get my trainers on and get out of this room now. Thank you so much for coming on. Really, really appreciate it. Thank you, everybody else, for listening. If you would like to keep up with the podcast, remember to follow our Spotify and our YouTube. Thank you.